Hello and welcome back to GP Video Podcast by Nadia. So today I am going to talk to you all about prevention and types of prevention. Now I have already done a podcast on this topic in the past, but I think it is a very important topic to address, and I'm doing it again because I'm sure many of you guys have not listened to that podcast before or have not watched the podcast before. And because it's such an important topic, I would like to repeat it again. You guys also know that I have already started talking about Red Book by RACGP. What is Red Book? Red Book is about screening procedures which are in the community, present for the community to be screened for specific diseases, and how that book helps general practitioners with implementing those screening procedures in the practice in the community. So I've already started talking about that. But before that, it is very important to orient ourselves as to what is screening and what level of prevention it falls under. Like, is it primary, is it secondary, or is it tertiary? What is prevention itself? What is screening? What are the types? And what are we talking about? Okay. So let's start talking about prevention and types of prevention. And then I will tell you that screening comes under secondary prevention and how it fits that criteria and how it fits that main group. Okay. So prevention of a disease includes a wide range of activities known as interventions aimed at reducing risks or threats to health. Okay, preventing, as it's an English word, it's not a medical term. It's an English word. Prevention means doing something to stop something from happening. Okay, so preventing it from happening. This article that I'm sharing with you is about primary, secondary, and tertiary prevention. And it says that you may have heard researchers and health experts and general practitioners and other doctors talk about three categories of prevention: primary, secondary, and tertiary. What do they mean by these terms? And as you guys always know, this is a very common saying for any disease that prevention is better than cure. Definitely 1000% prevention is better than cure. So what are the types of prevention that a general practitioner or any other doctor can share with you? It is primary, secondary, and tertiary. So what does primary prevention mean? Primary prevention aims to prevent disease or injury before it ever occurs. So like preventing it from happening at all, okay? This is done by preventing exposure to hazards that can cause disease or injury, altering unhealthy or unsafe behaviors that can lead to disease or injury, and increasing resistance to disease or injury should exposure occur. For example, immunization against infectious diseases, okay? Like, as we all know, all the childhood vaccines against diphtheria, measles, pertussis, tetanus, hepatitis B, nowadays COVID, influenza, RSV virus has come in the practice now, then pneumococcal virus. So all these immunizations that are in the practice, they come under primary prevention. So what they do is they actually save you from the diseases to happen. For example, if your COVID vaccine is for you, if you are exposed to COVID, and if you're vaccinated against it, there are much lesser chances for you to get COVID. Or even if you get COVID, then you will get lesser complications of the COVID. But basically, the first aim of an immunization is to prevent that disease from happening. And since the immunizations have come in practice, all those diseases that have got immunizations in place, all those diseases, their incidence and prevalence has actually gone readily very down. Or there are diseases that we have eradicated from the world, like smallpox. So primary prevention means stopping the disease from happening. So one example is immunization. Number two is education about healthy and safe habits. For example, eating well, exercising regularly, not smoking. For those people who are at increased risk of developing, let's say, cardiovascular diseases, heart attacks, strokes. Then, for example, legislation and enforcement to ban or control the use of hazardous products. Example, asbestos or to mandate safe and healthy practices, example, use of seat belts and bike helmets, from preventing the injuries happening from motor vehicle accidents. And so all of these things that we do before something happens. So for example, stopping smoking before you suffer from lung cancer. So all that kind of primary preventative strategies mean those strategies that can altogether stop the disease from happening should you get exposed to it, or should you be at the high risk for it, or you can get that. So from preventing you from that to happen, that's called primary prevention. Secondary prevention. Secondary prevention aims to reduce the impact of a disease or injury that has already occurred. This is done by detecting and treating disease or injury as soon as possible to halt or slow its progress, encouraging personal strategies to prevent re-injury or recurrence, and implementing programs to return people to their original health and function to prevent long-term problems. So one of their examples is a screening. So what does a screening do? Screening screens the asymptomatic individuals, people who have no symptoms, okay, but are at higher risk of developing that disease. So screening means that who are we screening? If we are not screening the symptomatic individuals get investigated and treated. Okay, they are not the ones who get screened. Screening is done for the people who are asymptomatic, they have no symptoms, but they are at higher risk of developing a disease. For example, breast cancer, cervical cancer, lung cancer, all these cancers, if somebody who has no symptoms whatsoever, but is at increased risk of getting, for example, somebody who has got 20 years of smoking done, or somebody who's got family history of breast cancer. So all of these people are at increased risk of developing these cancers. So we can offer them, screening. Now, what age should the screening start from? And what are the screening procedures in different countries? Because screening, so for example, we do not have any established screening program for lung cancer as yet, but there are talks that it would be coming in the market very soon, and then there are specific criteria for it to be fulfilled. So for example, let's say it will start after 50 years of age, it will start for the people who've got 20 years of smoking. I'm just giving you some examples. So but still it's not there. So what basically screening is screening means that you will screen individuals who have no symptoms but are at increased risk of developing it. So, and then you have got screening criteria again, what age, and how strong the family history is, and there are many other things. So what Red Book does is, Red Book tells general practitioners to tell the patients who come and see them about the criteria of the screening procedures for different things, for different diseases, cardiovascular, cancers, metabolic, all sorts of broad categories. And what are the screening procedures we have? So for example, we do have breast cancer screening. We do not have lung cancer screening. We do not still have established prostate cancer screening, though we can still offer PSA. So what are the different conditions? GPs have to definitely identify the people who are at increased risk of developing such conditions, and then tell them about the criteria, tell them if they fulfill that, and get them to done the screening procedures. I will talk to you tomorrow about what tertiary prevention is, and then we will go back to Red Book and we will talk about screening and secondary prevention. And then I think we've already spoken about bladder cancer, but we'll continue talking about skin cancer.